It's really a great honor to see so many of you passionate and dedicated leaders, researchers, and practitioners gather here in Singapore to shape the future of mental health in Asia. There are 70 speakers in this symposium and 300 delegates that come from 25 countries, and it beholds on us to really ensure that the mental health support is accessible, relevant, and effective across the very different, diverse communities in our region and very different healthcare system that they are all relevant to everybody in Asia.
We gather today not just as professionals, but really as individuals deeply invested in the well-being of our communities. Moving forward, perhaps we need to step back, focus on the human development basics, and to rebuild trust in communities, prioritize kindness as foundations of mental health.
I firmly believe that together, we can change the mental health narrative, one human story at a time.
Mental health is not a luxury. It is a prerequisite for sustainable development.
I've heard a lot here about mental health challenges, cure, care. What about the gym for mental health, so that I don't get in this situation?
This strategy relies almost entirely on resources that every country has, people who care for others in their community.
The mental health strategy
We need a platform, especially in Asia, bring together policymakers, innovators, clinicians, advocates, NGO, people with lived experience to come together and discuss what more we can do to address mental health.
Really excited for the symposium because this marks the official launch of the MHI and Asia Hub, and this is really exciting because we get to finally expand into the Asia region and get to be able to address the mental health needs in the region, understand what is already being done, what are the innovations, what are the resources.
And I think to destigmatize it, to be able to then apply science to it, to make it accessible for all, I think this is just a great start.
So I think this discussion is really a start of larger collaboration across the entire ASEAN region into co-creating solutions with each other for different communities and different issues and problems.
We've had some great speakers, very diverse backgrounds, which have inspired me already on both policy and clinical level.
This is an opportunity to create this network that's so important.
Our intervention is a snakes and ladders game where we use word association which is present on each quiz. It has significantly reduced depression and anxiety, which we see over here using the PHQ and GAD scale.
Every year we have more than 300 children living with cancer being treated at the hospital without no psychosocial support. I hope that this project can integrate the mental health care into cancer care for the Vietnamese population.
I